Can pressure ulcers and wounds cause pain? This is a question I frequently encounter. I'm Alan Bienstock, and I'm a board-certified plastic and reconstructive surgeon. I specialize in wound care, particularly in patients who are homebound and bedbound. So to answer the question, yes, wounds and pressure ulcers can cause pain for different reasons. Most of the time, people get wounds or pressure ulcers from pressure, which in itself can cause pain. When you have a wound, which sometimes can get infected, this definitely can cause pain. So why is that? Well, there's inflammation as well as infectious particles and chemicals that can cause pain and trigger a pain response. How do you manage this? Well, in people that are older or in the geriatric population, you don't want to supersaturate them with opioids or what we call pain medication like Vicodin, Oxycontin. It's better to use long-term anti-inflammatory medications if they're medically relevant at the time. Some people have medical conditions that prevent them from having certain anti-inflammatory agents, such as Siloxane, Motrin, other anti-inflammatories. Other options are pain medication that treat neuropathy, such as gabapentin. Things that I do like for a lot of my patients is a combination of medical marijuana, which is THC, with CBD oil. This can be very helpful and generally has limited side effects, but this has to be titrated and administered by someone who prescribes medical marijuana. I'm not pushing medical marijuana, but I've seen it significantly reduce pain response as well as overall mood. So how do you address pain? Well, the most important thing is if the pain is due to the wound, is you have to address the wound, which means that if it's infected, it has to be either surgically debrided or the person has to receive, your loved one or the person has to receive oral or intravenous antibiotics. Most of the time this can be done in the home if you have a really good team managing this. If this is not available, then sometimes you have to go to a doctor's office if that's possible, and hopefully you can dodge or avoid and obviate the need to go into the emergency room. If you have any questions about pain and pain control, please feel free to reach out, and please subscribe when you get a chance. Thank you.